When living with type 1 diabetes, food sometimes starts to feel like the enemy. Every bite feels like a math problem or a test that's maybe even hard to pass. My name is Scott Johnson, and today we're talking with Rita Rubin, a registered dietitian with decades of experience in diabetes, about how to simplify nutrition, not by following more rules, but by using food as a flexible tool that actually supports your life and your diabetes. I'm excited to welcome Rita Rubin to the show. Rita is a registered dietitian and certified diabetes care and education specialist who's been helping people with diabetes for decades, 20, 30 years. Rita, thanks so much for joining me today.
No, thanks, Scott. Thank you for inviting me.
Of course. Can we get started by helping our listeners learn a little bit more about your role at Blue Circle Health and a little bit of your background?
Sure. I am a registered dietitian and a certified diabetes education specialist, so diabetes educator. And I work with people with nutrition, with navigating the journey around food and type 1 diabetes, and really any self-management challenges, topics, education topics that come up. So anything really around type 1 and management of type 1.
How would you describe your professional journey in diabetes care? How did you get started?
Well, I was really lucky when I first became a registered dietitian. I landed with this amazing team at a local outpatient diabetes care and cardiac rehab program. And they were just fabulous folks. And so my work really involved working with people with all kinds of diabetes, type 1, gestational, type 2. But over the years, that work really transformed as I started to focus more and more on people living with type 1. And, it's been my focus now for a really long time. And once I started working with folks living with diabetes, I was just hooked. And again, I just really love the work.
Yeah. And again, that really comes through in everything that you do. Are there aspects that you find challenging still, even with all of your experience?
Yes. Definitely. So, I think one of the biggest challenges these days is helping people who are living with food insecurity.
Yeah.
We're seeing that more and more of that happen, where folks are going through part of the month without enough food to eat and not enough resources to find food. So that's been something that's been coming up as a real challenge is how do I help people eat when there's not a lot of food to choose from?
Yeah.
And then adding living with type 1 diabetes on top of that. And so that's been particularly difficult. And, at Blue Circle Health, we try to pull together all the resources that we can. We have this amazing case manager, Carrie, who is amazing at finding ways to help people. And we have wonderful resources that we can draw on, but that's a tough one. And then more generally, I think with nutrition, everybody has an opinion, and not necessarily a bad thing. We all have unique experiences with food, and for the large part, when you see recommendations about nutrition, it's probably working for somebody.
Yeah.
There's often a lot of noise, social media, there's a lot of noise to sift through a lot of the time. So that's probably the part that is also sometimes difficult, but also just another challenge. Just to find your way through it and find what the truth is and what's meaningful for each person that I'm working with.
Yeah. Do you think that there's much difference in thinking about nutrition around type 1 diabetes versus thinking about nutrition just for normal overall health?
Yes, absolutely. Because there's another layer of attention that needs to be paid, right? With type 1 diabetes, there's the effect that you see every day of the food on your blood sugar levels. Living with type 1 diabetes, you have some concerns about some additional complications that might happen later in life. And so nutrition can play, I think, an even more salient, important role for folks living with type 1, just because you have that added layer of complication.
Mm-hmm. Yeah,
Right?
that makes sense. Well, one of the things that I'm hoping that we accomplished during our time talking today is that we can help simplify this topic of nutrition and help people think of it as another useful tool in their toolbox. But I have to admit that I often feel quite overwhelmed when I think about nutrition and cooking. And I think it's probably much of what you talked about, this big, exciting, ever-changing domain, right? And to me, that it feels like a lot. Why can nutrition feel that way for so many of us?
That's a great question again. Yeah. For the nutrition nerd that I am, it's exciting to me, but yes. And yeah, totally can be overwhelming. The sheer quantity of information flying at us every day is overwhelming enough. There's a lot. And again, like we talked about earlier, there's so many different messages coming at us. And it's hard to sift through all that and find out what lands true for somebody and what's misleading or just outright false. So I think that can be particularly overwhelming, just sifting through that. Plus, again, living with type 1 and having to think about nutrition in a totally different way than somebody who doesn't live with type 1.
Yeah, there's often a lot of emotions attached to that, and we'll talk about that through our discussion too. But one of the things I want to ask a little bit more about is, what are some common fears or misconceptions that you hear from people about nutrition that you work with?
The biggest misconception is that we are all the same, and we're not.
Yeah, that's so true. Again, it parallels our lives with diabetes. There's not one, the guiding principles and some of the methods, but we all have to figure out what works best for us. Food can also be quite a big trigger for shame with a lot of people. Why do you think that is? Why does it carry so much emotion with it?
Emotionally, what could be more personal than the food we choose to nourish our bodies with? And then you have external sources giving you information about the goodness or the badness of those food choices. That can be incredibly confusing and certainly shame-producing.
Yeah.
There's just a lot of judgment and misconceptions, right, about what type 1 diabetes is and, what somebody with type 1 diabetes should be eating. There's so many shoulds out there, aren't there, Scott?
Yeah, there's so many. Yeah, and when I feel like I'm not doing what I should be doing according to whatever I've got in my head, then I do feel bad about it. I feel kind of judged. It's funny because our team this week is sharing pictures of our meals to help with one of our social media campaigns coming down the road. And I find myself, I haven't shared any pictures because I'm just so embarrassed of like my simple one color plate of food and the others are sharing these beautiful compositions. And I know it's kind of silly and I kind of chuckle to myself, but there's a lot of emotions there.
Oh, that's huge. That's that's vulnerable.
Yeah. Do you find that happens when you are talking? Because it's not much different, right? Me sharing with the team about what I'm eating versus coming in, meeting a new diabetes educator, a new relationship in my diabetes healthcare team, and doing something like a food diary or describing what I like to eat. It feels kind of scary. I'm sure you see that. How do you help people kind of get through that?
Well, gosh, I see that all the time. And my heart goes out to everybody who is in that position of presenting what they're eating to somebody or doing to somebody who's a provider or a medical person. And again, that's an extremely scary position to be in and very vulnerable.
Yeah.
Open yourself up to judgment. I really listen to people to start with and respect where they're at and let them know that there is no judgment at all. And really, I certainly don't start off with, okay, can you send me your food diary?
Yeah.
That's just a scary thing. And the evil food diary.
Yeah.
Nobody likes to do that. So, it's more like, in me, it's more like a conversation. Tell me more about, what does your day look like? What do you like to eat? If you're not eating what you like to eat, what would your desires be about what you would like your meals to look like?
Yeah.
Instead of, the analyzing like every calorie and carb, really trying to make it a more easy conversation. And then from that, get to understand somebody's concerns, their feelings of vulnerability around things, the things that they might want to change. Not the things that I would like them to change, but what would you like to change? So, trying to come at it from that approach is, I think, helpful.
Yeah, absolutely. And I think you're in a bit of a more luxurious position where you've got a little more time that you can spend building relationships with people and gaining trust. And before you have to get into some of those nitty gritty details, right? That's got to feel kind of nice. And it's one that the system doesn't usually afford.
It doesn't at all. No, I've worked in the system and there's a whole lot of pressure to gather as much information as possible in a short period of time. And that often does not lead to good outcomes. It doesn't build trust. It's not a great system.
Do you think it's possible for someone to be too focused on food and type 1 diabetes?
Yeah, for sure. Again, that's a subjective experience for sure. But I have seen some downsides of that for sure.
It can be kind of a slippery slope, right? Like we have to pay enough attention to be able to stay healthy and stay safe and live well. But we also have to watch that we're not sacrificing our quality of life or some of those other things. So yeah, absolutely.
I agree. Yeah. If I see signs of, somebody changing their social life, not gathering with friends or going out to eat or eating with friends or family or restricting whole groups of foods or skipping meals or, anything that's causing extreme stress around food, not enjoying food anymore.
Yeah.
That's huge. I see that a lot. And that's, such an important part of being human and our existence here on this planet is to eat and enjoy what we're eating. That when that goes away, that's a big concern.
So when you do see some, when your antennas start buzzing, you're seeing some signs. How do you approach it? Is it as individualized as many of the other things that you teach?
Oh, sure. Yeah. I might start to explore with somebody, maybe what their wishes are around food. Like what kinds of foods appeal to you at this time of day? If you could wave your magic wand and eat whatever you want, I don't care. If it's bologna sandwich for breakfast, doesn't matter. Just let me know. What are those things that you might really enjoy at this time of the day or at this snack? Not to say you're going to go eat them, but I just want to learn more about what your preferences are. And, we'll just make a list. We might get to a point where there may be some light, where there might be a chance to maybe add one of those foods back in, in a small portion, in a safe environment to try it. And again, it doesn't matter what it is. I don't care if it's considered healthy or not.
Yeah.
It's just about maybe making it feel a little safer to expand those food choices. And, as you know, with anything, you take a little step, and if you're okay, you're willing to take another little step. And I don't know that it necessarily will make fear around food just totally go away.
Sure.
But if somebody can start to enjoy their food more often and engage in their life more often, then that's so valuable.
Those are big steps. Yeah, absolutely. Well, this is a good time for us to take a quick break here. And when we come back, we're going to keep talking and talk about simplifying the approach and giving folks some practical tools. So we'll be right back.
Hi, I'm Becky, and I'm part of the team here at Blue Circle Health. I've been living with type 1 diabetes myself for about 30 years. We love hearing stories from people who've participated in our program, and I have one here from Patty in Ohio, who's been living with type 1 diabetes since 1999. I'd love to read it to you. I was so excited to see a flyer for Blue Circle Health at my doctor's office. I had never seen a program specifically for T1D and checked into it as soon as I got into my car. At the time, I had been diagnosed with severe gastroparesis and was having problems with having low blood sugars. Through Blue Circle Health, I was able to have a team of wonderful people who not only understood the struggles of living with T1D, but also helped with dealing with my newly diagnosed issue. I gained so much helpful information from the people I was in touch with. I can't say enough great things about the program. I am very thankful for Blue Circle Health. Thanks for sharing your story with us, Patty. It's an honor.
Before we dive back in, I want to make sure you know about the ADA Food Hub. This is not an ad. There's no sponsorship involved. They don't even know I'm doing this. The ADA Food Hub is a great resource from the American Diabetes Association, and it's completely free. They have online cooking classes, both live and on demand. They have tons of great recipes, nutrition insights, and healthy eating tips. There are also meal planning tools, including a customizable meal planner and a grocery list feature. Check all of that out at diabetesfoodhub.org. We also have several cooking classes led by Rita available on our Blue Circle Health YouTube channel. Welcome back. Rita, let's talk a little bit more about simplifying the approach. I mentioned how overwhelmed I often get myself about it, but I think my hope is that by the end of our conversation, we want people and myself to be thinking about nutrition as a toolbox, not a rule book. Do you think that sounds reasonable?
I love that approach. Absolutely.
Great. If you think just at a high level about simplifying nutrition, the phrase simplifying nutrition, what does that even mean to you?
I would say, first of all, is ease up on the rules.
Mm-hmm.
And know that your body is resilient, and that there's a lot of space between the rules. That the rules can be very helpful and can be really good guidelines, and then it's okay to bend them to fit who you are. So aim for a variety of nourishing foods during the day. Throw in some fun foods now and then, and try to end the week feeling like, okay, I did all right.
Yeah. I love that approach, looking at it from kind of zooming out a little bit, looking at your week versus a day or even an individual meal. And the week, of course, is built up of those smaller things, but that gives me more of a sense of possibility by looking at it in a week. If I didn't meet my goals for a meal or maybe even for a day, it doesn't mean that it's shot.
Exactly. Exactly. Yeah. It's sort of, I guess, Scott, like looking at your blood sugars, right?
Yeah.
Is you can look at the blood sugars at a moment or during a day, maybe a day there you're not feeling so great about your blood sugars, but then you zoom out and you think, okay, but overall, I'm doing all right. Right. So yeah, I think you can do the same thing with nutrition. And I think another way to simplify it is really to start looking at or start to pay attention to how food makes you feel. Again, connecting with that internal wisdom of your body. I often find when people are starting to maybe change some of their eating patterns and experimenting with different patterns that feel healthier to them, they'll often come back and say, I noticed when I ate this way, I didn't have those cravings in the afternoon.
Interesting.
Or, I didn't feel so tired. Or when I ate that meal, I noticed my belly didn't feel well. I got all bloaty and it just wasn't great. But when I eat this way, I'm all right. So, it's another way to think about it is listening to your own body. What is it saying to you? Yeah,
that makes sense.
Mm-hmm.
Is there such a thing as good enough nutrition? And what might that look like?
Definitely good enough is good enough. Yeah. So again, stepping back from those rules of I have to have all of these nutrients every day and maybe just looking at some simple guidelines like, okay, I'm going to try to eat 3 meals a day for the most part and try to have a variety of foods on my plate. Might try to have some vegetables more often. The USDA plate guidelines it's actually a great tool, and it can be a template for not only day-to-day meals, but also week to week, and where you've got a lot of veggies on the plate, half the plate, maybe a quarter of the plate, some sort of protein, a quarter of the plate, some sort of carbohydrate. Yeah, that's, I think, good enough.
Mm-hmm. Yeah, I like that. It gives me a sense of possibility that this is something I can actually accomplish. It also, there's even thinking from that angle, right? You can think about the distribution of those categories on your plate, and that's one aspect of it. And then over time, you can maybe look at increasing the quality of those particular food groups over time. But it's not like I have to jump in today from eating all my junk food to going to a high quality whole food, perfectly distributed plate by tonight's dinner. There's no way to do that.
Right. That's setting a high bar. So yeah. I think with making any changes, set that bar low. Maybe not so low that it's like, yeah, easy peasy. I've done it yesterday. Maybe bump it up a little bit. So maybe it's a little stretch, but it's not going to trip you up.
Yeah.
And you're going to feel good about it. And then, yeah, I love that idea is you just start somewhere and you think, all right, I did that. Maybe I'm going to look at increasing the quality here. So maybe the next goal is to, maybe introduce some more whole foods and less of those ultra processed foods that it's so easy to grab and go, right?
Yeah.
Simple thing might be instead of grabbing, potato chips and dip, maybe it's a whole grain cracker and some cheese.
Mm-hmm.
A little bit more nutrients there, a lot more nutrients in some cases. And probably a more filling snack or a light meal than potato chips. Yeah. And then you might say, I haven't had a whole lot of veggies today. Maybe I'm going to throw some cherry tomatoes on a plate. So kind of trying to add more whole foods, less processed foods. That can be a really good way to think about simplifying nutrition. More food that's closer to what it looked like when it was grown or produced. And,
that's a great way to think about it. Let's talk a little bit about carbs, right? Carbs sometimes get a bad rap in diabetes because they are the primary nutrient responsible for our blood sugar increases. But it can drive some to aim for a very, very low carb lifestyle. I'd love to hear, one, just your thoughts on that in general, but then two, if there's a difference between a very intentional and well-planned low-carb approach versus a approach that's driven based on the fear of carbohydrates and what that'll do with blood sugars.
Probably the big difference is the fear. Yeah. If there's an understandably fear of the effect of carbohydrate on your blood sugars and managing insulin and having the variability that occurs when you start to add carbohydrates into a meal and uncertainty. It's all valid, but very, very stressful.
Yeah.
Whereas if you have, more of a sense of, well, this is the way that I enjoy eating. This is the way I feel best living with type 1 diabetes. This is my way of eating. And you're safe with it. You're getting enough carbohydrate. You're not risking the buildup of ketones because there's not enough carbohydrates in your diet and, other nutritional deficiencies because I'm not having enough carbs. Then I think that's probably the biggest difference is that you're choosing to eat this way because it makes you feel good.
Mm-hmm. Yeah.
And it's working well for you, then that's fine. But if there is something else that you'd rather be doing, but you're not doing it because you're afraid, that's a big difference right there.
Yeah.
And something that, you'd want to just get some support with.
Yeah, absolutely. Does it make sense to think about experimenting with food versus that complete dietary overhaul? And what does that even mean? What might that look like?
I think experiments are great ideas. It's just more of that, taking that small step instead of setting the bar really high and putting these huge expectations on yourself and maybe your family and your friends. So yeah, experiment and do it in a way that you feel safe. So, again, I would go back to that list. Like, what kinds of foods sound good to you right now? At this meal, at this snack, what would you like to be eating if you could have anything you wanted? And then choose a food. And then maybe you start with a small portion in a safe environment. Like maybe you don't want to eat that food when you're out at a restaurant or at a party eating with friends, but maybe when you're home and you're safe and you can control the other factors in your environment and try it. And see what happens. You might reach out to your providers or your peers and say, I'm thinking about adding this food. What do you have? What do you got for me?
Yeah.
A little help over here. What should I expect? What should I look for? How should I dose? Gather information, especially if you're feeling pretty scared about it, and give it a try. What you'll get back is data. Yeah.
Oh, that's so valuable. I love that you mention it and frame it that way, because experimenting with food can feel a little bit scary when we're dealing with trying to match insulin doses. And so it makes a lot of sense to me to experiment and gain a little bit of confidence in a controlled environment. Does it make sense to start by building a handful of very predictable meals and doing that over time? What are some benefits of taking that approach?
Oh, I think predictable meals are a great idea. Yeah. And especially too, in our busy lives, right? I think having some meals that are just easy fallbacks.
Yeah.
When, you may have the greatest intentions of coming home and baking a chicken and roasting some broccoli, but life doesn't provide you the opportunity to do that always. Yeah. And so you've got some easy things in your pantry that you can just throw together. Maybe it's a peanut butter sandwich.
Yeah. I'm kind of chuckling over here because I'm thinking about some of the experiments I've tried in cooking something new, and it didn't work at all, right? And so the choices then are, well, I could suffer through this terribly prepared meal because I took my insulin for it, or I can turn to one of my fallback meals that I've got here. I can turn back to something that I know and that'll do the job, and then I can try again next time.
Sure. And they may be some easy, freezer meals, right? Like some frozen burritos or something, or, pasta with, a jarred sauce and a salad. It doesn't have to be complicated.
Yeah, I love that. Can you talk a little bit about why balanced meals are so important, and how does a balanced meal benefit our blood sugars?
I think balanced meals are important in a lot of ways. So blood sugars aside, when I think about a balanced meal, I think that there's some interesting things on the plate, that there's some varied textures, maybe some varied colors, maybe, but probably some protein, some vegetables, some, fiber, and maybe some beans or a whole grain, or some sort of carbohydrate. And really, there's actually science that shows that, our brains kind of analyze what we're about to eat, before we even eat it. And certainly our digestion even starts before we start to eat. Even thinking about food or smelling food starts digestive juices.
Yeah.
Charting. So there's an expectation about whether that meal will be satisfying or not, like before you even start to eat it. And so if you go into a meal with a plate that looks beautiful to you, whatever that means, then your brain is going to say, okay, this is going to be a good meal. I'm going to feel good after I eat this meal. I'm going to feel satisfied. I'm not going to feel hungry.
Yeah.
And so there's a whole psychological part of it. And then physiologically, when we eat a balance of nutrients, there is that sense of fullness and satiety. We have fiber and protein in our meals that are going to slow down our digestion. Maybe that fiber is going to expand in our guts and make us feel fuller longer. Certainly can slow down the conversion of carbohydrate to glucose so that blood sugars maybe rise a little bit more slowly after the meal and give insulin time to get in there to do the job. I think that's really, such a benefit. And it doesn't even have to be a complicated meal like that cheese and crackers and cherry tomatoes, instead of a pile of potato chips. There's a lot more interest on that plate. And I think your brain's going to say, okay, I think this is going to be great. Physiologically, when you're looking at blood sugars, when you've got more than maybe just carbohydrate on your plate, then the impact of the food on your blood sugar.
Yeah.
It's going to be smoother. It's not going to necessarily spike up really quickly.
I love that you were talking about how the brain sees things. And when we think about that, what are some mind shifts around nutrition that someone might start to play with after hearing this episode?
I hope that maybe shifting thinking about all or nothing, good and bad. There's so much variety in the world, with regard to how people eat and how people living with type 1 diabetes eat, and how people living with type 1 diabetes eat a variety of ways and have good health.
Yeah.
For long periods of time, with good time and range, that there's a way to do that. Maybe it takes some time to figure it out, some help and care and support from other people, but there's a way to do it.
Yeah.
And to find a way where food can be pleasurable and healing and soothing and comforting, and you can have the fun foods when you want them. Balancing it with, some good plates of food regularly during the week. There's maybe like an awareness of more like gentle nutrition that I would hope for, that you can rely. Yeah. You can rely on your own wisdom more than those external messages that are coming through everywhere.
Yeah. And work to, take in that information. It's some of it's good, and you can decide what stays with you and what you let pass by. I love that approach.
Yeah, because it probably works for somebody, and you can, sift through it and say, I want to try this, and maybe give it a try. And maybe you'll say, yeah, that didn't really work, but I like this one piece of this approach. That worked for me. And you can kind of put together, it's like a jigsaw puzzle, right? You can put together your own plan and, do what works for you.
Yeah, I love that. Well, we've covered an awful lot today, and I feel like you did a great job of just kind of summarizing things. But is there anything that I maybe didn't ask about, or something you feel is important to leave listeners with as they end this episode?
Well, maybe going back to simplifying nutrition, and maybe just some basic guidelines that I would share. I would start with make time to eat. Give yourself that gift of making time to have a meal, to have several meals during the day.
Yeah.
And, honor your body with that. Honor yourself with that self-care, that you can take time to nourish yourself. That guideline of, three basic meals a day, maybe throw a snack in now and then when you need it. But I think that's a really good basis for good nutrition. Using that plate guidelines, eat more vegetables. Always eat more vegetables.
Always eat more vegetables. Yeah, I'm working on it. Yeah.
It doesn't have to be more complicated than that.
It's very simple. I love that.
And if you look at your own routines and you think, I really want to start to improve this or change this aspect of my nutrition. And like you were saying earlier, like maybe I might want to improve the quality of what's on my plate. Start someplace small and then just go from there.
That sounds like a great way to bring this episode to an end. We're going to start small. We're going to experiment. We're going to use some of the principles and guidelines that you shared to keep us healthy and safe. And we're going to take the time to build the relationships with those around us who can help us and support us on the journey. And we're going to take it slow and simple and steady. I love that. Well, Rita, thanks so much for taking so much time today. I really appreciate it. And we'll have to have you back on again soon.
Oh, thanks, Scott. Again, thank you for inviting me. It's been a real pleasure.
Thanks for listening today. I hope you'll try one small nutrition experiment that feels doable to you, and consider letting go of at least one rigid food rule that isn't serving you at all. I'm going to try my best to do that as well. And remember that it's okay to ask for help or guidance around nutrition. You can always visit bluecirclehealth.org to see if we're available in your state, or ask your healthcare team for a referral to a registered dietitian. And then be sure to tune in for our next episode, where I'm talking with the esteemed Dr. Bill Polonsky to help us find support and navigate diabetes distress. I hope you'll join us. And until then, keep living well with T1D.